Very, very good day, everyone. If this is your very first time, welcome. Come on in. Matter of fact, get close because you are so very, very welcome. We are the Neuro-Wellness Collaborative. We have Dr. Kitty Adderley, we have Dr. Wail Salam, and I am Dr. Ayana Miller. We are an international group of doctors of physical therapy, and this forum is where we engage with you on wellness, prevention, and function related topics in order to support your functional mobility. So let's have an honest chat. When is the last time that you almost took a tumble? When is the last time that you almost fell and you played it off as if you were dancing? Was it yesterday? Was it last week? Was it sometime this year? Or are you just a ninja warrior and you are always upright and you never fall? Or when is the last time that one of your loved ones almost took a fall? Was it within this current week? Was it last month? Has it been a while? If you are a caregiver of someone who may have some falling issues, when is the last time you had a problem getting them to use their walker? Are they refusing to use their walker? Are they going to the bathroom in the middle of the night and stumbling and tripping and falling and stumping their toe or breaking a hip? Or you're dealing with a person who has medication that causes them to get dizzy and they're always just jumping up, forgetting that they have to kind of take it slow. More than that, hey, are you a person who has a million cats in your house and there's always some pet under your foot causing you to trip and almost fall? Are you dealing with slippery floors? Sometimes at work, you might be in an environment where the floors are slippery, or maybe you have kids that have toys on the floor all the time. Are you one of those people, admit it, that has throw rugs and cords all over the house? I mean, your living room looks like a spider web. You've got so many cords. So tell us what your experiences are. We want to hear from you. We want to engage with you. What are your experiences with near falls? Have you had any near fall experiences? Do you have a loved one that has had some near fall experiences or is living with falling issues? Are you helping to take care of a loved one who may, have some balance issues and challenges? Because falling is preventable. Let's hear from you. What is your experience? I see we have Crystalline with us. Hey, welcome, Crystalline. Crystalline, any fall issues with you or anyone that you care for or any of your loved ones? Any recent near fall experiences in your life or anyone else have any near fall experiences? Well, feel free at
Hello,
any,
can you hear me?
hey, we can hear you. How you doing today?
Okay, I'm good. I'm actually driving and I zoomed in. Zoomed
Oh,
in.
okay. Well, welcome. We're welcome to have you. We are here live, and this episode is being recorded. So if there's any
Okay.
experience that you have had or a loved one has had with near falls or uh, close call falls, and you would like to share, feel free to do so. If you're a person who has throw rugs or cords, I recently went to someone's house and they had a cord stretching over the stove across the door. And I was like, wait a minute, wait a minute. Not only is that a fall risk, but that is a fire hazard. So,
Right,
so we're doing all kinds of things in the house and sometimes are not really conscious of it. Have you had
right.
any fall or near fall issues recently, Christy?
Well, speaking of near falls, I just recently had one as of yesterday, a near fall.
No kidding.
And
What happened?
I was on my way in the house and misstepped on one of the stones. And thank God I caught myself because I could have probably fractured or broken my ankle because my foot went over to the side. So when I stepped onto the step, I did not step onto the whole step. For some reason, I stepped on. I guess I like living life on the edge a little, must be, uh, because I'm always walking too close to the edge of everything, a wall, a chair. I mean, a door. I'm just always walking close
I
or
hear you.
stepping too close. So on that step, that stepping stone, Instead of me stepping my foot in the middle, I decided to step, I guess, on the edge, and my foot went over, and so I had to catch myself from falling. I was hoping neighbors didn't see me or anything. Um,
So you
and then
lose.
I just did a, yeah. So I just did a little thank God praise report that I didn't actually fall, or my ankle didn't go all the way over,
Yeah.
which have could have caused an injury.
Absolutely. Yeah, and
Yeah.
this reminds me, I'm one of these people who I'm committed to not losing my ability to wear heels. So I'm here walking in a restaurant one day, and there's some cobblestones that I have on some high wedge heels. And I mean, they were,
Oh,
and here I am tipping around, and lo and behold, because her shoe was not buckled really tight, her ankle rolled over and she fell in front of how many hundreds of people?
oh,
Girl, everybody looked and the people felt so sorry for me. They came running to try to help me get up. But again,
oh my God.
my footwear in a public place, okay, walking over some cobblestones, and I tumbled
Oh,
and fell in a restaurant. So thank God I was not injured. And I'll
thank
tell
God.
you, no. But this is the thing. For most of us, remaining upright comes naturally, but it actually requires balance, okay, which is what we're kind of getting at as we talk about losing our footing. That's kind of what has happened with you and I in these examples, Chrissy. We lost
Mhm.
our footing, and so
Oh,
remaining upright it requires balance, and that balance actually requires skill. But because it comes naturally, a lot of us don't really think about it. But our bodies are constantly battling against the lurking forces of gravity. Gravity is always pulling us down to the earth. Why? Because if it weren't for gravity, we would be floating. So our bodies are constantly trying to maintain upright against these forces of gravity that lurk around us at all points in times. There are lots of factors, whether they be internal or environmental, that play a part in our balance and our ability to win the war against excuse me, so that we don't fall. And so some of those factors might include our vision. The vision. There's so many cues and so many messages that come into our brains through our eyes, including our orientation in space. Where are we? Are we upright? Are we to the side? Are we flat on our face? The vision plays a large part in us maintaining
mm,
balance. Not only that, posture plays a part as well. Are we bent over? Has our center of gravity changed, which causes us to be off balance as well? And then we have muscle strength. Do we have enough strength to fight against gravity? If we think about a baby, babies have not developed the muscle strength as yet. So a lot of times when you sit a little newborn baby up, they topple over because their muscles have not developed the strength required to keep them upright against gravity. So there's lots of factors. You and I talked about some environmental factors, whether it be footwear, whether it be faulty stones or cobblestones on the ground that we could walk over. But the bottom line is that a fall can change everything in a matter of an instant. Like you talked about, Chrislyn, you could have a fall and injure your ankle. You could have a fall and hit your head. But if you have the right preventative measures in place, you can really change the outcome of what could be potentially devastating. So let's talk about fall risk. Let's talk about real solutions that will help us to maintain our independence, maintain the health of our bodies and bones, quite honestly, and keep us a step ahead of the game. So, like I mentioned before, I introduced Dr. Kitty. She is joining us from Exuma Island in the Bahamas. And we have Dr. Wail Salam. I believe Dr. Salam is currently in Cairo, Egypt, if I'm not mistaken. If I'm mistaken, he will correct me. But Dr. Kitty, what would you suggest to the viewers where falls are concerned and a checklist of things that can be kept in mind? What can we keep in mind to kind of make our homes risk-free? I talked about those folks who like to have the spider web homes with all the cords, the extension cords everywhere, or the throw rugs. There was a time when I was doing a lot of home health, and I would go to a lot of senior homes, and I don't know why they are so obsessed with these throw rugs. and always catching the walker on the throw rug and putting themselves at risk for falls. So, Dr. Kitty, anything that you can offer for keeping the home risk-free or health conditions, medications, and so forth that you might want to offer the viewers, our guests, where preventing falls are concerned?
Certainly. Thanks, Dr. Diana. So you did a great workup and an introduction on what we call home ergonomics. Like usually when you think of ergonomics, you always think about the office, right? Or the workspace. And what ergonomics is the science of creating an ideal space for the human body to function where we reduce the risk of strain and injury. So, like I said, we always think about it in the professional commercial work setting. But let's talk about ergonomics in the home. Dr. Diana mentioned throw rugs and extension cords or electrical cords around the house. What we want to do is we want to make sure that we set up our homes where it's going to give us the best outcome, meaning that it's going to keep us in our best posture. It's going to make sure that our lighting is appropriate so we can see where we're going. We're going to make sure that the surroundings themselves do not present hazards or risks. So we talked about the rugs. We talked about electrical wires. We even talked about pets. People like to have their pets around the house. They like either the teacup puppies or the kittens that are dashing in and out, or even the bigger dogs. They can pose a risk. Now, I'm not telling anybody to put their pet out, but make sure that you are very aware of where your pet is as you move around the house. So let's go back to the house itself. To prevent falls, one of the things we want to do is make sure that the surface that you're walking on is what we call slip resistant or absent from things that may trip you, like the throw rugs, big pieces of furniture. Sometimes things fall and we take a while to pick it up. That's a risk. You can turn back and slip on it if it's wet, or if it's grainy like rice, you can slide on it. So you want to keep your slip-free surfaces as clean as possible. We're starting from the ground up. Then I mentioned furniture. Try to avoid bulky furniture with sharp ends. Again, clothes can get trapped on it. You can trip, you can bump into it and tumble over. And then you want enough space to maneuver around the room. I can tell you doing home health in some patients' houses, like I literally have to crawl on the bed with them because there's so little space between the dressing table or the desk and the bed. There's no space for me to maneuver, much less them. And so be very aware of where you position your furniture, as well as the size of the furniture. So that's just the basic gist of it, right? So let's do things. If you know you have a balance issue, what we want to do is we want to make sure we have supportive chairs. We want to know that we have assistive aids. You want to make sure that if you're in the restroom or the kitchen, there are grab bars, because we know that those surfaces have a likelihood of being more slippery when wet. So you want that extra safety in the bathroom. You want grab bars near the toilet or in and around the shower. Again, be very careful with the mats that you use. You want non-slips there. If you have balance challenges, I always recommend a shower bench or a shower stool that allows you to sit down comfortably and safely. And then you want a handheld shower as well. So you don't have to stand. You can bring the nozzle down to you. I think those are the most important things in the bathroom and in the bedroom. But when we go to the kitchen, you want to make sure that you have step stools that you can either position on or step up instead of overreaching and you can tumble back. You want to make sure that you're standing up and you have anti-fatigue mats that have a nice slip resistance of grip to the bottom of it. And try and use pads wherever you can. So if there's a likelihood of you bumping into furniture, try and pad. They have these nice little styrofoam pads or foam pads that you can put on the edge of the furniture to soften the edges. So in the event that you do bump into something, you're not bruised properly. The other thing we want to address is your lighting. Make sure your light is adequate. I mentioned it before, but I really want to come back and do that. You want to make sure that the lighting is adequate. Now, we've talked about designing the house. What about you? What do you need to be aware of? If you have vision issues, make sure you get your eyes tested at least once a year. right? Because we can develop deficits as we get older. Yes, our farsightedness gets worse, our nearsightedness gets worse, but we can also lose what we call peripheral vision, the ability to see on the sides. And that's how often some people fall. So pay attention to your vision. You want to get your annual medical physical exams every year so we can monitor progressions, have the conversation with your physicians, get it documented. And also let's review your medication. There are many times when we are what we call polypharmacy, meaning that you have multiple drugs. Those drugs can have a cumulative effect. They can have side effects that we need to watch out for. That's if you're taking medication. So you want to make sure that all your medication is listed, whether it's over the counter or it's prescribed, because these medications can impair your balance, it can impair your breathing, it can impair your ability to sense. So you want to make sure that that's taken care of. And so let's go back to your senses. That's the medication. Let's talk about your senses. Is my sight intact? Is my inner air balance intact? We don't think of that as a sense, but Ayana mentioned before that that's something that we have to pay attention to because our body struggles with that, or not struggles with that, but our body is constantly keeping us balanced. And what happens, sometimes those changes are so subtle over time, we don't realize the impairment that sets in. So you want to pay attention to that as well. For my people that are living with neuropathy, and those can be people that are living with diabetes, or if you've had some cancer intervention and it's left you with chemotherapy-induced neuropathy, or you've injured some nerves in your spine that affect the senses in your hands and your feet, you're more at risk for falling. So this is why it's imperative for you to have those visits with your medical professional, your physician, and also consider getting a physical therapy annual exam as well, because what we will do, we're very thorough in watching the way you move, your muscle strength, your joint health and range of motion, but also your sensation. And when it comes to your sensation or your senses, we're talking about the balance. We test your balance. We test your proprioception. That's your ability to remember or recognize where your body part is in space. Some people, they step thinking that the ground is closer than it's not because their proprioception is off. So we test that as well. And then we also test just your overall functional movement. And that is so important as you move around. So I know I've given you a whole heap of things to think about. Just always remember to reach out to your physiotherapist, because our whole focus is to make sure that you function at your maximum capacity. So what I'll do now is I'll pass it back because we have lots more information to cover for you today.
And I thank you so very much for that, Dr. Kitty. What an excellent explanation of how we can maintain safety in the home and what to be aware of not only externally but internally as well. And I have got to just, you know, highlight a couple of points that you make. Sometimes we think, oh, everything is fine. That's those other people. It's not going to happen to me. But I kid you not, just this morning, as I was getting out of the shower, I was thinking to myself, okay, I am not going backwards in life. I am aging. And here I am walking out of the shower. The floor is wet. It's tile. At some point, I am going to need a grab bar. I will need a no stick mat or something to make sure that as I take a step up to come out of the shower, I don't slip and fall. As I age, what if the vision is not as acute as it is now? Okay, what if there's a little episode where I might slip, or if a throw rug to soak up the water, what if it slightly moves a little bit? Because I'll tell you, as estrogen levels decline,
Mhm.
we get weaker. In men, as testosterone levels decline, they get weaker. So this is something that we should not take for granted. Understand that body changes do occur and we are all at risk. For those of us who say, well, I don't need to take my medication. Yes, you do. You need to comply so that you don't become dizzy. Maybe you have medication to control vertigo, but then maybe you also have medication to prevent you from getting vertigo, or they may cause vertigo. So, we have to be very, very much aware of what we're taking, what we're supposed to take, and compliance issues. So thank you so much for that, Dr. Kitty. Dr. Wail is waiting so patiently. and we want to hear from him because I know he has something to tell the community where falls are concerned. He is a wealth of knowledge. Dr. Wail, what can you tell us about preparing our bodies, functional exercise and activities perhaps that will improve the musculoskeletal system, improve the neurological system, which are crucial to helping us to maintain upright throughout the lifespan? Dr. Wail, let's hear from you.
Okay, what you say, Dr. Ayana, is great. What you said, that lifespan. Yes, I have my body organs. I have only one body organs. I don't have substitutes. I have to keep it all my lifespan. If I injure it, I can't use it and it be disabled. Take care. Life maintenance is the most important skills that the human being have. Do you know that we are reflex? This reflex starts at the first of the third month of gestation. We call it deer paralysis reflex or fear paralysis reflex. This one of these reflexes that maintains our life to protect me from falling and all of our dangers around us. What is falling? Falling is just that is two forces, my body coming against the projections and the hard tissue and the hard surfaces, and that could damage my bones, my muscles, my ligaments, my skin, whatever, my internal organs. And you can see that the internal organs keep in a good strong bones. So we have to go in this area. We have to start first, like Dr. Katie said, that about the environment, to make the environment and surrounding about around me, it is not causing an injury and strength in injury. At the same time, we have our body. We have to strengthen our body because when I fall, the bone should withstand the force of falling. My ligaments should be flexible. The bone should be hard. The muscle should be weak, strong enough to withstand all of these. And then the musculus, the nervous system. Nervous system, we have a special nervous system that we are very skillful how to protect ourselves. But for your knowledge, you have to know that these reactions of equilibrium reactions and protective reactions, it is a reactions. It starts from these skills. When I fall, I don't think what's the skill, how I can protect myself. It will go by itself. That's why this kind of skills started from a very early time at the first of the third month of gestations. Okay, so I repeat it a lot and a lot, and start from a visual memory to short-term memory to long-term memory to unconscious memory. At that time, I fall without thinking. So we have to train ourselves about this kind of falling. I give you some simple exercises to give you. First, we have to know that we have to customize the each one because all of us we have a different if you have a special problem. But for ourselves, first of all, we have to know the ground or the projection around me. So stay at the ground as much as you can. Try to lay in the ground, creep in the ground, crawl in the ground, make your ground because you have to understand what the ground, you have to discover the ground. Big for have a long surface foot, if I a big surface foot, if I have a big surface foot, there's the friction force will be high, so I'll be stuck on the ground. My foot, it is specialized to coop or capture or to catch the ground. I have big foot, don't wear the shoes, don't wear the socks, please, and go barefoot in a different surface, in a slippery surface, in a rocky surface, in grass, or whatever. So make your foot developed well because your foot will be stuck on the ground. And then if you want to balance yourself, I balance myself according to the best of support that when I rooted or I don't have to say I don't know how to say it when I come rooted in the ground like that, like the root of the tree. So, but your hands,
Like
this
when you
hand, the
plant your
first
foot, I think you want to say when you plant your foot, Dr. Wael.
Yes, like plant cries. With my hands also, Dr. Ayana, is very important. Do you know that my hands, all equilibrium reactions, what equilibrium? Simple equilibrium to put the center of gravity within the base of support. So I have to move this is a rocky and unstable COG when center of gravity. So how can I put it? I put it by my hand. This is like two wings. So good hands is very important. Also, how can I protect myself? Simply we could protect extensor drastic flex when I put my hand like that. So I make my face and my sensitive organs away from the ground. So creeping is very important. Each child should creep well. When you creep well, you know you understand the ground well. You know how to protect yourself. You know how to be away from the ground. So your hand is very important to develop it as much as I can, as you can. And the creeping is good. Walking on foot is good. Lying on the ground and practice a lot of exercises on the ground. Great. Also, we have to your eyes. Yes, you it's lighting is good, and we have to use our eyes. But you know that we have skills of eyes. I have the eye who can um, see at the day and see at the night. I
Mhm.
have two eyes. So I have two eyes working on the day and night. Now we are staying on the night all the day, all the time. We have artificial lights, so we don't have night to see in it. So I don't have a skill of seeing at the night. So I have to protect my to practice walking at dark and practice and dark and at moonlight. So also we have a lot of visual skills. We have to train it. One of these skills we have what we call it the vestibular system. This vestibular system is so important. This is the water inside our brain. It's in cavity. This water when we are walking, the water walking with us. And within this water, within a cilia, that when the water moves, the cilia move, and that gives us information what is the position of the head in space. And but that way we can go to the equilibrium reactions good. So we have to train this vestibular system. Between this vestibular system and the eye, we have a big relation to know the depth perception. Do you know that the depth perception is the third dimension? So by the depth perception, I can measure when I fall in the ground, I measure the distance between me and the ground. And when I fall, when I throw a ball toward you and want you to catch you measure the distance and to get your hand at the proper time to catch the ball. So training your eyes and what we call it vestibulo-ocular reflex should be important to train this kind of reflexes and the vestibular system. All of these. Also, we have to move a lot. Movement means that we have a way of our body. I have to understand my body, and the brain should be has a relation between my body organs. I have to know what is my knee, what's my hips, what's my foot. All of these coming to the brain, so the brain can get a good information to our body to protect ourselves. Protection is a life maintenance activity.
Absolutely. I tell you, y'all better be ready when Dr. Wail starts talking because Dr. Wail is going to bring it. Okay. I'm just here to let you know Dr. Wail is and Dr. Kitty, they both, I just love hearing from both of them because they bring such a wealth of knowledge from different perspectives. Here we have Dr. Kitty telling us about the functional aspects of maintaining our safety. And then we have Dr. Wail, who is educating us on also the developmental sequencing aspect of how to ensure that our bodies are best prepared to keep us aligned and to keep us from falling and keep us oriented in space, to keep us prepared so that we have this relationship with ourselves, gravity, and the ground. Hopefully, we don't become too familiar with the ground. But as Dr. Wail said, having and Dr. Kitty, in fact, that visual acuity, the vestibular acuity, these are aspects of our bodies. Even Dr. Wail talked about your limbs, your hands and feet, making sure that they are well fit and trained to help keep you in upright. Thank you both for those beautiful explanations. And I also just want to go a step further and debunk some misconceptions about falling being a sport only for the elderly. and I say a sport with tongue in cheek, it certainly is not a sport at all. But as we talked about, falling is an issue across the lifespan. We know that for one, children fall, okay? Excuse me. Sometimes they trip and fall while they are exploring the world. Okay, Dr. Wail mentioned that safety from falling begins in the first through third months of gestation, where we began to develop sequentially the protective mechanisms to so that once we're born, we are automatically beginning to develop to beginning to strengthen our abilities to fight against gravity. So we know that when children are playing, a lot of times they will trip and fall as they are exploring the world. And most of the times they do recover quickly, but there are issues where sometimes they break bones. There are issues where sometimes they may get a concussion or contusion if they hit their head in just the right spot, which Dr. Kitty talked about. You have to make sure that you safeguard your home so that you're not hitting your head, especially. But then we also have to prevent our children from hitting their heads by creating safe play spaces for them and supervising them. But then what about the young adults? I'm not a young adult, but I am an adult, and I'm a middle-aged adult, and I'm one of those persons who refuses to let go of youth. So here I am wearing heels and not fastening them properly. And I'm walking on an unlevel surface and I tumble and fall in public. And that is not related to some of the issues that maybe our elderly population faces. That's just simply, not having proper footwear. But then we also have young adults who are walking and doing this, walking and texting. They are distracted and they're putting themselves at risk for falling. What about our young adults who go out on the weekends or sometimes during the week and they have alcohol induced falling? Sometimes we get drunk. Okay, let's be real, let's talk the truth. We've got people who are drinking, okay, becoming intoxicated. They hit their heads, and they are in the emergency room on Monday morning. Okay, and you're seeing them in the acute care setting, okay, physical therapists. So one bad fall can really cause some injury. We have to be very, very conscious of this. And too many hits on the head, Muhammad Ali, can lead to other pathological issues. Remember, your head is very precious. It houses your brain. And if you fall and hit your head one too many times or in just the right spot, as Dr. Wail mentioned, your vestibular system can be thrown off, where you can have permanent damage, where you can have trouble balancing and righting yourself. What about middle-aged people? Those folk who, get to a point where they're not exercising anymore. They're gaining weight. They're developing chronic illnesses. Dr. Kitty mentioned they may be developing cancer issues that might require treatment that leads to neuropathy. What about our middle-aged people who are now developing diabetes-related neuropathy? The sensation in the hands and feet. Dr. Wail told us you have to have foot fitness in order to plant your feet. He said to root your feet, but he meant what he was getting at is planting your feet firmly so that you can grasp and conform your feet and have good balance and good strategy in your feet, your ankles, hips, and knees. Okay. And then we talk about our older adults. We most times associate falling with the older adults, but as I have mentioned, and as the doctors have also mentioned, falling is not just relegated to the elderly. However, they are at greatest danger. They're very frail, and a fall for them can mean a broken hip. It can mean a loss of independence. It could certainly mean life-threatening complications. So we want to protect our elders and all of our loved ones across the lifespan. Falling is certainly not relegated only to our elders. Well, now's the time where we open up for question and answer. I see that we are a little bit short on time, but if you have a couple of minutes, if there are any questions or any final comments or thoughts, you're welcome to mention those now. If anybody has a wonderful story about a person that had great success, maybe after a fall, and they want to spotlight a good story. Everybody loves and enjoys hearing a positive case study or a positive story. Feel free to offer that now. Anyone? Any final thoughts? Well, If not, I just want to throw back to what Dr. Kitty said before, just before we go, just to remind you that your doctor of physical therapy is here as a skilled professional who can help you to improve your balance, who can help you to come up with strategies so that you can safely stay upright and maintain your confidence and independence throughout your lifespan. We welcome you to see us every month. We're here the first Saturday of every month. We welcome you to join us from 12 to 12:30-ish if we're not having technical difficulties, because we are not tech gurus. We are doctors of physical therapy. So join us. Feel free every first Saturday of the month from 12 to 12:30. And we also invite you to like and subscribe. But remember, do not be selfish. Share the value, folks. Share it with your friends, your families, and even your enemies. So that's all for now. Have a
Thank you.
wonderful weekend, and we'll see you next time.
Thank you. Enjoy the podcast.
Thank you for being with us.
Thank you. Bye-bye.
Have a great
Bye.
day, everybody. Bye.
Good day.
Bye.